What if I told you that the common cold and the flu, two illnesses that feel so similar, are actually very different in how they affect your body, how fast they hit, how long they last, and, most importantly, how you should treat them? You might think they're just different names for the same thing, but that's a dangerous misunderstanding, especially when it comes to protecting your health, your family, and your community. In the next few minutes, you're going to learn the real differences between a cold and the flu, what happens inside your body with each, how to spot the difference fast, and what to do right now if you, or someone you care about, gets sick. By the end of this video, you won't just know the facts, you'll understand how your immune system reacts, why symptoms vary, and how to handle each illness the right way. Let's get into it. What are colds and the flu in simple terms? Both colds and the flu are respiratory illnesses. They affect your nose, throat, airways, and sometimes your lungs. But they are caused by different viruses. They affect your body differently, and your immune response to each can vary dramatically. The common cold is usually caused by rhinoviruses, but many viruses can cause cold-like symptoms. The flu is caused by influenza viruses, specific strains labeled type A, B, and rarely C. This difference in cause leads to big differences in severity, onset speed, symptoms, duration, risk of complications, how they attack your body, immune system basics. Your immune system is your body's defense army. When a virus enters, whether a cold virus or the flu virus, it triggers your immune cells to respond. With the cold virus, the immune response usually stays localized. Inflammation is moderate. Symptoms are milder and focused on the nose and throat. With the flu virus, the immune response is systemic. It spreads beyond the nose. Inflammation is stronger and widespread. Symptoms can affect your whole body. This is why a cold and the flu feel different, even though they both attack the respiratory system. Cold versus flu. The key symptom differences. Let's break down the real-world differences in symptoms, the kind that helps you tell them apart fast. 1. Onset. How quickly symptoms appear. Cold. Symptoms usually come on slowly. First signs are often sore throat, followed by runny/stuffy nose. Flu. Symptoms hit suddenly, sometimes within hours. You can go from feeling fine to feeling terrible very quickly. 2. Fever and chills. Cold. Fever is rare in adults, more common in kids. Mild temperature, if any. Flu. Fever, often high, 100 degrees Fahrenheit/38 degrees Celsius or higher, is common. Shaking, chills, and sweats are frequent. Fever with fatigue and muscle aches strongly suggests the flu rather than a cold. 3. Muscle and body aches. Cold. Muscle aches, mild or absent. Flu. Prominent muscle and body aches can be severe. Pain in back, legs, shoulders, and whole body. This difference is a major clue. 4. Fatigue and weakness. Cold. Mild or moderate tiredness. Flu. Significant fatigue and weakness. You might feel exhausted even after resting. Many people with the flu describe a feeling of being hit by a truck. That's the immune system firing hard. 5. Cough severity. Cold. mild cough, usually dry or productive. Flu, moderate to severe cough, dry and persistent, can last weeks after other symptoms improve. 6. Headache, cold, rare or mild. Flu, common and often moderate to severe. Headache with fever, muscle aches and chills points strongly toward flu. 7. Complications, when things get serious. Cold. Complications are uncommon, mostly congestion, sinus discomfort, mild cough. Flu. The flu can lead to serious complications, including pneumonia, bronchitis, sinus infections, ear infections, worsening of chronic conditions, asthma, diabetes, heart disease. For vulnerable populations, older adults, infants, people with weakened immune systems, the flu can be severe and even life-threatening. How long do symptoms usually last? Cold, 3 to 7 days. Some symptoms, like cough, may linger slightly longer. Flu, 5 to 14 days. Fatigue and weakness can continue for weeks after. This difference in duration reflects how deeply the flu virus affects the body compared to common cold viruses. Why they feel so different inside your body. When a cold virus infects your body, your immune system mounts a localized response, mostly in your upper respiratory tract, sinuses, nose, throat. The result is congestion, runny nose, sneezing, mild coughing, things your body manages without a major systemic stress response. When the flu virus infects you, it doesn't stay local. It triggers a systemic immune response. Interferons, cytokines, and other chemical signals flood your bloodstream, leading to fever, muscle aches, fatigue, loss of appetite, headache. This is why the flu feels like a whole body illness rather than just a sniffle or sore throat. Is it possible to have both at the same time? Yes, co-infections can happen, especially in seasons when multiple viruses are circulating. But generally, flu symptoms dominate and are more severe. Cold symptoms are milder and don't usually include fever or body aches. If you feel severely ill with sudden onset, high fever, and systemic symptoms, assume the flu until proven otherwise. Testing, when and how it's used. Healthcare providers can diagnose the flu with Rapid Influenza Diagnostic Tests, RIDTs, PCR tests for influenza virus, clinical diagnosis based on symptoms and timing. Colds are usually diagnosed clinically. Doctors look at symptoms and rule out more serious conditions. Testing is most useful when symptoms are severe. There's risk of complications. You are in a high-risk group. Treatment differences. What to do with each cold. Treatment. Since colds are viral, antibiotics do not help. Cold care focuses on symptom relief. Rest, hydration, warm fluids, saline nasal rinse, over-the-counter pain relievers, acetaminophen/ibuprofen, throat lozenges. Most colds resolve on their own within a week. Flu treatment. Flu is also viral, but there are specific antiviral medications that can help, especially if started early, within 48 hours of symptom onset. Oseltamivir, Tamiflu, Zanamivir, Baloxavir. Antivirals can reduce symptom severity, shorten duration, lower risk of complications. Other flu care includes rest, hydration, fever reducers, avoiding spread to others. Flu versus cold. Impact on daily life. Flu tends to knock you out for days, make simple tasks feel exhausting, disrupt sleep, appetite, and energy. Cold tends to cause inconvenience, interrupt comfort, but not daily function, be manageable with minor care. This difference is why many people stay home with the flu but try to power through a cold. When to see a doctor. You should seek medical attention if you experience difficulty breathing, chest pain, confusion or severe dizziness, symptoms that rapidly worsen, high fever not responding to medication, dehydration, dark urine, dry mouth, dizziness. Severe symptoms in infants or the elderly. These can indicate complications requiring urgent care. Prevention. Stopping both cold and flu. While colds don't have a vaccine due to many virus types, the flu does. Annual flu vaccination protects against major circulating strains, reduces severity if you still get sick, lowers risk of hospitalization and death. Other preventive strategies for both include frequent hand washing, avoiding close contact with sick people, good respiratory hygiene, cover coughs or sneezes, staying home when sick. Cold versus flu. Timeline comparison. Cold. Onset, gradual. Peak symptoms, days 2 to 4. Duration, approximately 7 to 10 days. Flu. Onset, abrupt. Peak symptoms, days 2 to 3. Duration, approximately 5 to 14 days. Recovery, fatigue may persist longer. Why this matters? Beyond the symptoms. Understanding the difference between a cold and the flu isn't just academic. It influences how you care for yourself, whether you seek medical help, when you should isolate to protect others, how you manage your energy and responsibilities. Mislabeling a flu as just a cold can delay treatment and increase risk of complications, especially in vulnerable populations. Final takeaway. Cold versus flu in plain language. Here's the easiest way to remember. If it feels like a sniffle with mild discomfort, it's likely a cold. If it hits suddenly with fever, chills, muscle aches, and deep fatigue, it's probably the flu. Both are viral, meaning antibiotics won't help, but flu has specific treatments and vaccines that can make a real difference. What you can do next. If you or someone you know is sick right now. 1. Rest and hydrate. 2. Monitor symptoms closely. 3. Consider flu testing if symptoms are severe or sudden. 4. Use fever and pain relief thoughtfully. 5. Practice good hygiene to protect others. And most importantly, don't dismiss severe symptoms as just a cold. Understanding the difference can change outcomes. What happens when you get both at the same time? It's rare, but yes, you can catch both a cold and the flu simultaneously. This is known as a co-infection, and it can make you feel even worse than having just one of these illnesses. When you get both, the symptoms tend to be more severe, and the duration can be longer. you may experience stronger fever that doesn't go away easily, more severe fatigue, making it harder to get out of bed or function. Dehydration becomes a real concern because your body is fighting two infections at once. Increased risk of complications, especially if you already have underlying conditions like asthma, heart disease, or a weakened immune system. While co-infection is uncommon, it's still important to know that it can happen, especially during flu season when both viruses are circulating. This is why early treatment for the flu is so important, and why you should get vaccinated each year to reduce the chances of severe illness. When to seek medical attention for cold or flu. Knowing when to see a doctor or visit the emergency room can make a huge difference in preventing complications. While most colds and flu can be managed at home, here's when you should seek professional help. Cold. Difficulty breathing or shortness of breath. Persistent high fever lasting more than a few days. Severe facial pain or headache, especially with sinus symptoms. Symptoms that don't improve after 10 days or worsen suddenly. Flu. Difficulty breathing or chest pain. Persistent high fever, especially over 103 degrees Fahrenheit or 39.4 degrees Celsius, or fever that doesn't go away with medication. Severe headache with nausea or vomiting. Unusual drowsiness or confusion, especially in children or elderly people. A history of chronic conditions, for example, heart disease, asthma, diabetes, that are being exacerbated by the illness. If you feel like you can't recover on your own, or you're concerned about worsening symptoms, it's always better to err on the side of caution and get medical advice. The importance of rest and hydration during illness. Whether you have a cold or the flu, rest and hydration are key to a faster recovery. Rest. When you're sick, your body needs time to fight off the infection. Rest helps your immune system work more efficiently and can speed up the healing process. Hydration. Staying hydrated helps to loosen mucus, ease congestion, and prevent dehydration from fever or excessive sweating. Drink plenty of fluids such as water, herbal teas, and broths. In addition to water, you might want to consume electrolyte drinks or oral rehydration solutions, ORS, especially if you have a fever or are experiencing diarrhea or vomiting. How to prevent the cold or flu from spreading. Both cold and flu are highly contagious, so it's important to take steps to prevent spreading the illness to others. Here are some effective strategies to reduce transmission. 1. Stay home. If you're sick, especially with the flu, avoid contact with others. Stay home from work, school, or social gatherings until you're feeling better, usually 24 to 48 hours after fever subsides. 2. Practice good hygiene. Wash your hands frequently with soap and water for at least 20 seconds. If soap and water are unavailable, use a hand sanitizer with at least 60% alcohol. 3. Cover your mouth and nose. Use a tissue or the inside of your elbow to cover coughs and sneezes. Dispose of used tissues immediately. 4. Disinfect frequently touched surfaces. Cold and flu viruses can live on surfaces for several hours. Regularly disinfect things like doorknobs, light switches, remote controls, and your phone. 5. Avoid touching your face. Viruses enter your body through your eyes, nose, and mouth. Avoid touching these areas with unwashed hands. vaccination, and preventing future infections. One of the most effective ways to prevent the flu is through annual vaccination. The flu vaccine is designed to protect against the most common strains of the influenza virus circulating each year. Here are some key things to know. Flu vaccines reduce your chances of contracting the flu, and even if you do catch it, the vaccine can help reduce the severity of the illness. Flu shots are recommended for everyone aged 6 months and older, especially for high-risk groups such as young children, the elderly, pregnant women, and people with underlying health conditions. While there is no vaccine for the common cold, good hygiene practices and a strong immune system can help reduce the frequency of infections. How to strengthen your immune system for cold and flu season. A strong immune system is your best defense against both colds and the flu. Here's how to naturally boost your immune system and stay healthy during flu season. 1. Eat immune-boosting foods. Your diet plays a crucial role in supporting immune function. Include these nutrient-rich foods: vitamin C-rich foods, citrus fruits, strawberries, bell peppers, and leafy greens help your immune cells fight infections. Zinc-rich foods. Zinc supports immune cell function and can reduce the duration of cold symptoms. Foods like beans, nuts, seeds, and whole grains are great sources. Probiotics. Fermented foods like yogurt, kefir, and kimchi support gut health, which is integral to immune function. 2. Get regular exercise. Moderate physical activity increases circulation, boosts immune cell function, and can reduce inflammation. Aim for at least 30 minutes of exercise most days of the week. 3. Prioritize sleep. Sleep is essential for immune function. During sleep, your body produces cytokines, which help fight infection. Aim for 7 to 9 hours of sleep each night to keep your immune system strong. 4. Manage stress. Chronic stress weakens the immune system. Regular relaxation techniques like deep breathing, meditation, or yoga can help manage stress and support immune health. 5. Stay hydrated. Proper hydration is essential for immune function. Water helps carry nutrients to cells and remove toxins, making it a key player in staying healthy. Drink plenty of water throughout the day, especially if you're sick or during cold/flu season. Know the difference. Be prepared. Understanding the difference between a cold and the flu isn't just about knowing symptoms. It's about understanding how each virus works in your body and how to manage it when it strikes. Both illnesses are treatable, but they require different approaches. Cold, a mild virus, treatable at home with rest, hydration, and over-the-counter remedies. Flu, a more serious illness that can benefit from antiviral medications, especially if caught early, and requires more rest and symptom management. By learning the differences, you can take the right steps quickly, get the appropriate treatment, and prevent complications. If you found this video helpful, don't forget to like, subscribe, and share it with anyone who might benefit from understanding cold and flu differences. Thanks for watching, and stay healthy.